Hello. So my name's Christina McLean, and today I'm going to be chatting with you all about a scoping review I completed on predictive analytics and their application to the social determinants of health. So before I dive into my review, I just wanted to take a moment to reflect on the reality we're facing in terms of chronic disease prevalence in Canada and the significance of the social determinants of health. The infographic on the left shows the prevalence of chronic disease among Canadian adults, and we can see that 1 in 10 adults over the age of 20 have at least one of the chronic diseases pictured on this slide. And to the right, we can also see that to achieve good health, people need more than good health care. They also need adequate income, employment, education, and healthy places to live. These social determinants of health are complex influences and are some of the most important factors affecting health. So with this information in mind, wouldn't it be great if we had a program or a model that could predict which groups would benefit most from a specific public health intervention, or that could predict how certain policy or program interventions would impact health outcomes? What if there was a way to achieve this using predictive analytics? Before I get into the details of my project, I just wanted to provide a brief definition for some context and so that everyone knows what the heck I'm talking about. For those who may be less familiar with the term, predictive analytics refers to a variety of statistical and mathematical techniques used to predict future events. So some examples include predictive risk algorithms, predictive models, and machine learning. So with that in mind, let me introduce my practicum project and practicum placement. I completed my practicum with Island Health, working within the food security, healthy lifestyles, and community health networks. Can everyone still hear me all right with the mic not too close? Perfect. Yes, food security, healthy lifestyles, and community health networks public health program area. The focus of my practicum work was on the community health network evaluation. As part of its mandate to support a healthier population, Island Health has supported the development of community health networks in the Island Health region. Community health networks I'll refer to as CHNs. So CHNs are multi-sector, geographically based groups that take action on shared social determinant of health priorities. All CHNs have the common purpose of improving community health and well-being through upstream prevention activities. And there are currently 9 CHNs in the Island Health region, which receive leadership and funding support from Island Health. In order to illustrate changes in the determinants of health and health outcomes resulting from CHN activity, an evaluation plan has been created. And described in the CHN evaluation plan is a 3-component evaluation. My practicum project was linked to the 3rd component, which is a comprehensive outcome evaluation. A key goal of the CHN evaluation is to develop an impact tracking mechanism that will support ongoing assessment of CHN outcomes beyond the intensive evaluation period. The development of this tool will be informed by existing evidence-based predictive algorithms and predictive models. So in this case, predictive algorithms or models relevant to key CHN action areas, such as housing or air quality, will help to identify changes that occur from CHN action on the social determinants of health, even where direct measurement is not possible. So while efforts to build predictive models and algorithms using social determinants of health data are emerging, the value of adding non-clinical data has not been firmly established. So for my culminating project, I conducted a scoping review on the application of predictive analytics to the social determinants of health, and particular emphasis was placed on identifying existing predictive algorithms and models. My scoping review addressed the following question: what is currently known about the use of predictive analytics for predicting future health-related outcomes when applied to the social determinants of health? I invite you all to take a sip of your coffee or tea every time I say the word predictive in this talk. My search was limited to full-text English language peer review articles published between 2009 and 2019. Additional inclusion criteria included discussion of the application of predictive analytics to at least one social determinant of health, and discussion of future health-related outcomes and at least one social determinant of health. The electronic databases used in the search included Academic Search Premier, Medline, Web of Science, Google Scholar, and CINAHL. The Prisma flow diagram shown here just provides a bit of an overview of the review process. A total of 434 records were identified. After title and abstract screening, 380 articles were removed, leaving 54 full-text articles that were assessed for eligibility. And after this process, 17 articles were kept for final synthesis. Of the 17 articles included in the final review, 5 focused on predictive algorithms, 9 discussed the use of predictive models, and 3 discussed machine learning techniques. For the sake of this presentation, the application of machine learning approaches to the social determinants of health are emerging, but data remains limited. So for the sake of brevity, I'll focus on my findings regarding predictive algorithms and models. In terms of specific algorithms, new predictive algorithms have been developed in the last 4 to 5 years to quantify the influence of social determinants and behavioral risk factors on chronic disease. From my literature search, I found 5 predictive risk algorithms that met inclusion criteria, an example being the Chronic Disease Population Risk Tool, or CDPORT. Predictive risk algorithms such as these can be used by public health planners to inform prevention efforts by estimating the risk of disease, identifying populations at greatest risk, and estimating the effects of different proposed interventions. With regard to predictive models, all of the models obtained in this review fell into the category of dynamic simulation models. So these refer to computer simulations of large samples of individuals and their behaviors, states, and actions over time in order to predict health outcomes. In the context of public health, the evidence suggests simulation models can be used to assess the current impact of public health interventions, as well as to predict the future long-term impact of interventions on health outcomes. Importantly, it was found that simulation models are particularly useful for estimating the impact of interventions that cannot be measured directly due to practicality, resource limitations, or acceptability, which I think is an important part to keep in mind when you're working in public health. To further assist with reporting results, I also extracted information on key social determinants addressed and categories of outcomes for each of the articles. Just up here, you'll see that the most common social determinants addressed in the articles were lifestyle and healthy behaviors, followed by built and natural environments, income and employment, housing, social cohesion, and education. The most common outcomes discussed in the articles were chronic disease risk and mortality/morbidity, followed by chronic disease prevalence, life expectancy, and air quality. For each predictive model included in the review, I also extracted data on specific interventions that were modeled. The most common interventions were healthy living interventions, so things such as physical activity interventions, smoking cessation, and alcohol interventions. Next were healthy built environment interventions, some examples being introducing active transportation policy or designing pedestrian-friendly communities. These were followed by interventions improving access to primary care, income and employment-related policy, housing interventions, and lastly, interventions targeting air quality and social cohesion. So the emerging evidence found in this review suggests predictive analytics are a promising methodology to examine complex health issues. They offer a novel method to examine the long-term impacts of a wide range of interventions. With regard to the implications for public health practice, predictive risk algorithms and simulation models can be used to inform the planning of public health interventions, evaluate current intervention impacts, estimate the future impact of interventions, and estimate the potential of replicating interventions in different jurisdictions. However, there are potential limitations to take into consideration. For example, while the utility of simulation models appears quite promising, there's a need to ensure models are properly developed and validated to avoid relying on models that lead to false conclusions. So that is still an area of ongoing research. Just to wrap up, this evidence suggests predictive analytics may allow us to consider new ways of approaching and assessing the impact of public health interventions and our promising methodology to examine complex health issues. Thank you all for your time. Thank you to my practicum supervisors with Island Health, all of the medical health officers and public health staff at Fort Royal, my PHSP instructors, and all of you here today. Thanks.
Can I ask you to slide over so you can get my Q&A?
And thank you to the timekeepers.
Indeed. Questions? Of course, we have a time for a couple. Oh, there we go. You have to put your hand up really high.
Hi, hello.
Huh.
I was just curious about, you mentioned that you did the extraction, like I extracted the data, et cetera, et cetera. So I'm curious about whether you had to learn how to use statistical software during the course of your practicum, or if that was something you already knew how to use, or did you have a statistician helping you out, or sort of what was that like?
No, I didn't have a statistician helping me out, and that's a great question. That was a secondary learning goal. I would have loved to have gotten acquainted with EpiReviewer, but I didn't have the time, so it was basic data extraction using Excel tables to keep track of everything, and going through and just reading and rereading several times, highlighting and pulling it out that way. Yeah.
Awesome. Thank you.
No worries.
And while I walk the mic back, can you get, oh, sorry, Nate.
Thank you for the presentation. I'm wondering if you have some insights or thoughts about what are the greatest barriers to taking this up in public health?
Ooh, oh man. That is a good one. I think, I know that there is a lot more that needs to be done in terms of, mentioning with predictive models, looking at some of the validation and calibration and more research there to make sure that they're properly built and usable and not leading to, some inaccurate results. I think capacity, there's going to be a need to overlap, individuals with more perhaps IT specialties and public health planners and public health professionals. And it is emerging. It is early days, so I think time and just seeing where it goes, and the data itself. So you could have the best, most sophisticated algorithms and models, but if there's gaps in the data or inaccurate data, then you're not going to get what you're looking for.
Yeah. Other questions? Yeah, it's a fascinating area. It's going to be a challenge.
Yes.
I think, yes.
In a
indeed.
nutshell.
In a nutshell. Other questions? No? In that case, thank you, Christina.
Thank you.